So hi, everyone from around the country, and welcome to today's seminar. Firstly, I'd like to take a moment to acknowledge the traditional owners and their custodianship of the lands on which we meet today. I pay our respect to their ancestors and their descendants who continue cultural and spiritual connection to country. We recognize their valuable contributions to Australian and global society. Just to introduce myself, my name is Nancy Kong. I'm a research fellow at the University of Sydney. I am a joint seminar coordinator with Rennie Lee at UQ. I would also like to introduce Professor Matt Sanders. Matt Sanders is a chief investigator in the Life Course Center, Professor of Clinical Psychology and Director of the Parenting and Family Support Center at the University of Queensland. He is a global leader in the field of evidence-based parenting intervention, the founder of the P Positive Parenting Program, which is in use across 58 countries and has more than 140,000 practitioners trained to deliver it to more than 7 million families worldwide, and is one of the University of Queensland's innovation champions. Welcome, Professor Matt Sanders. Floor is yours.
Thank you, Nancy, and good afternoon, everyone. I too would like to acknowledge the traditional owners and their custodianships of the land on which we meet today and pay my respects to ancestors and their descendants. In preparing for this presentation, it gave me a moment to pause and reflect on what were the key messages that I wanted to get across. And I suppose the beginning point is a great sense of frustration that some excellent work that is done through universities by social scientists all around the world has far less impact on policy and practice than we would like to think it could have. And the context for this discussion is that I wanted to use the example of our own work in the field of evidence-based parenting support as an example of social science innovation to look at the whole question of how we do the business of this sort of research in a way that would increase the likelihood of it influencing policy and practice and therefore benefiting children. And to identify in this presentation some of the challenges we confront and then the possibility of using research alliances to influence policy and practice. Well, the question why focus on evidence-based parenting support as a social science innovation, I think is captured in some way by this notion of good parenting being the clean water of child mental health, wellbeing and resilience. There are so many areas of children's development that have, in many instances, lifelong implications that are affected by the quality of parenting that children receive on a day-to-day, moment-to-moment, week-to-week, year-to-year basis. Now, of course, these influences interact with genetics and biology and a range of other environmental factors in determining the impact on children of parenting practices. However, I think it is fair to say that the parent-child relationship and associated parenting practices have been demonstrated to influence a very wide range of outcomes. And so evidence-based parenting support is considered, I think, a major social innovation because these are practices that are potentially modifiable. They impact on multiple child and parent outcomes. The idea that it's just about influencing children is contradicted by increasing evidence to show that parents are major beneficiaries of participating in a high-quality, evidence-based, culturally informed parenting program. These programs have been demonstrated in hundreds of studies and multiple meta-analyses as being effective, but they continue to evolve and they need to evolve because they're not a panacea, they don't work for everyone, and that we're still in a situation where the level of population reach or parental participation is low, particularly on a global basis. So I'd like to use Triple P just as an example of efforts that we've made initially. This is just framing the context for what I'm going to talk about, to illustrate the degree to which we have made gains, and then what the limitations of those gains are. I started my PhD in 1978, and the work for Triple P began at that time. And I've been working for the last 4 decades on developing a public health population-based strategy of evidence-based parenting support that is represented by this model of a tiered level of intervention of increasing intensity and narrowing population reach as you get up to the more pointy end of the intervention spectrum. So it's very much based on the notion of proportionate universalism, that everyone is likely to need something around parenting support at some stage in their parenting career. Not everyone needs the same thing, and that even the same individual might not need the same thing at different stages of their parenting career. But the evolution of an evidence-based set of practices needs to be informed by an iterative model of research and development to ensure programs that are developed have got a good ecological fit to delivery systems and parents who may be seeking to access these programs. So this is represented by this diagram and an associated paper in Prevention Science in 2015, starting with theory building and moving through the various phases of a pipeline to dissemination and sustained implementation of programs, informed throughout by consumer and end user feedback and engagement with the process. Now, with a program like Triple P that began basically as a PhD thesis, this diagram represents its growth over a period of 4 decades. For the first 15 years or so, it was just about developing a program, seeing who it worked for, and doing research around it. Virtually no impact on the availability of services or programs. We began dissemination in 1996 with the establishment of the Parenting and Family Support Centre here at UQ. In 2008, we had the first publication that the system of intervention could impact at a population level. And this is the growth since that time. There have been 37 countries that have been involved in the research. There's nearly 500 institutions involving over 1,500 researchers who've been involved in at least the publications from this work. There have been 385 evaluation studies, including about 180 RCTs. And so when you think about impact of a system of research that began as a thesis in psychology in terms of impact in terms of services and practitioners being trained, this looks pretty impressive at one level, and particularly now there's a national adoption of Triple P Online as a system which is going to be supported by the Commonwealth Government that will provide online access to about 6 different variants of the Triple P system from September. But innovation is a constant that is needed based on R&D. These are just 2 examples of work that we've been currently involved in. One is called Family Life Skills, Triple P, which is focusing on parents who have high levels of ACEs, adverse childhood experiences, in their background. And the second is focusing on work with the NRL relating to parenting support during junior rugby league games. And there's the whole idea of universal preparation of parents about how to support kids' enjoyment and participation, and a decrease in emphasis on competition and often associated conflict that can come with that. However, we have a challenge that the research on parenting, not just with Triple P, but multiple other evidence-based programs, has been insufficient to date to really impact in a meaningful way on policy and practice that is needed to shift the needle at a population level. The majority of parents don't participate in evidence-based parenting programs. There's no tracking at a population level of outcomes, and in fact, inadequate measures are available to track such outcomes and integrate them with administrative data sets. For example, no tracking actually of how much money is even spent on parenting programs, particularly evidence-based programs. So there's no accountability for the spend. Parenting researchers, their students, and those involved in program development, interestingly, have worked in relative isolation in Australia from each other and other stakeholders. In fact, this field has historically been associated with different programs attacking each other, ignoring each other, or damning each other with faint praise. So that there has been no system of collective working together around solving a problem. What's also associated with this difficulty is our university systems, our higher degree research training processes, our promotion systems, all the reward systems in the universities have tended historically to emphasize individual accomplishment, and in fact, what proportion of an accomplishment you account for individually rather than collective effort. Therefore, many of the skills that are associated with collaborative engagement are underdeveloped in researchers working in this area of social science. So the notion is that could building a research alliance that brought together different researchers and stakeholders in the area of evidence-based parenting support, could it have something to contribute? Bandura defined collective efficacy as essentially a shared belief in conjoint capabilities to organise and execute the courses of action required to produce given levels of attainment. Boy, that's a complex Bandurian definition, but fundamentally it's emphasising the importance of a person's beliefs in their capacity to shift together the things that are needed to make change. And building a research alliance has the potential that it would bring together research groups who are decoupled, disconnected, not communicating with each other, to enable folk to put aside differences and focus on creating a shared vision to improve the outcomes for children. Well, with a small grant from the LCC in 2020 in February, the foundations for an alliance called PAFRA, the Parenting and Family Research Alliance, was established. Now, this occurred after 20 years of trying to run a global Helping Families Change conference to bring together researchers from around the world around evidence-based parenting intervention, but with a real realisation that it was capturing folk who were interested primarily in Triple P as an intervention, but not necessarily others, and that needed to change. So PAFRA was established as a vehicle for advancing science policy and practice in evidence-based parenting support generically. It wasn't about any individual program. And this collective action by researchers, program developers, and stakeholders was envisioned to be able to produce greater impact than any of us had been able to do individually. Now, what the notion of collective efficacy builds on is the application of self-regulation theory at a collective level. So, for example, it's the coming together of the self-regulatory capabilities of individuals contributing to group processes, combined with the principle of what's the minimally sufficient level of support that might be needed to enable this to occur. So the group fundamentally is applying principles of personal change, values-related goal setting, tracking, monitoring of outcomes, the building of self and collective efficacy, a belief in our capacity to shift the things that are important, that we want to change, and then attributing those changes to both our individual efforts, but most importantly, the collective efforts of multiple people who've come together around the goal and the tasks, building the capability of collaborative problem solving to tackle numerous diverse problems that are getting in the road, with the idea of building independence and autonomy so that we're less and less reliant on grants and funding and so on to support an alliance from continuing, which will mean reduced support over time. So PAFRA is fundamentally a multidisciplinary research collaboration that's brought together leading Australian universities and research centres involved in this area of work, where they're actually involved in conducting research, communicating about it, and advocating relating to parenting, families, and evidence-based parenting support. So from a fledgling idea that started in 2020, with a little bit of support from the LCC, we were able to create, within 2 years, a viable, action-oriented, not-for-profit organisation that was fundamentally geared to utilising research from the social and behavioural sciences to improve outcomes from children. It involved moving through a series of phases from a vision statement to a memorandum of understanding that was the initial basis for bringing 19 universities together, then a constitution, and then registration with as PAFRA as a charitable organisation. Now, the vision statement that we landed on, that interestingly everyone could agree to, even though they may have come from, cognitive behavioural perspectives or an attachment perspective or an emotion regulation perspective, that it was fundamentally this: a society that values parenting as an integral part of a healthy and prosperous community in which evidence-based parenting and family support is accessible to all parents and carers, and where individuals and communities are empowered with the knowledge and agency to optimise children's developmental outcomes and well-being. So people were just saying, look, parenting is really important, but what's most important to us is the outcomes for children. So when you start thinking about building a logic model and how this whole process has to unfold, I'm going to go through some of the key headings of a logic model in terms of points of emphasis I'd just like to draw people's attention to. First of all, the input side. I mean, creating an appropriate organisational structure in its own right is a complex process, particularly where there are no immediate role models for how to do this. And it's occurring right at the beginning of COVID, where universities have little money to invest in things that are seen to be more speculative or future-oriented, and particularly that are not based on individual benefit for that individual university. So working through the processes, what helped us a lot was actually working with ASA, the Academy of Social Sciences, for advice and guidance on how to set up based on similar alliances that have been established, such as the Brain Alliance, reaching out and talking to groups who've sort of done it before. And of course, what needed to occur is clarity around things like decision-making, rights and responsibilities, legal sort of responsibility in case the organisation folds and so on. So we landed initially on becoming a company limited by guarantee, and then from there moving into a whole series of processes that would articulate basically what we were going to do. And what was essential for that was the development of what was referred to as a decadal strategic plan. Now, this was the outcome of that plan. And I'm not going to go through the details of this because it's too text dense, but I just want to share with you that we did a moderated workshop around establishing a vision, some of the core principles, which were principles such as being child-focused, family-centred, culturally appropriate, evidence-based, and collaborative, and then working out objectives and actions that were appropriate to these different priority areas, each of which was headed by a nominated person who chaired and facilitated following the one-day collaborative meeting to articulate the specifics of what was going to be accomplished. Over this process, we started to work on the development of a logic model which would explain the fundamental kind of inputs and mechanisms and processes, impacts and outcomes, and that this is considered at the moment as a work in progress. It's continuing to evolve. I want to focus on a couple of the mechanisms that I think have been important for us to embed in the design of the alliance that we've been working on. First of all, and most importantly, was to put aside self-interest. Now, everyone is conflicted in this space in terms of either having an allegiance or an involvement in the development of a program, an evidence-based program. And of course, some are involved in the dissemination and scaling of that. Most of these programs, incidentally, are not owned by individuals. They're owned by universities that employ individuals who own the copyright in these programs. However, the issue about moving away from attacking and not supporting each other to start to focus on the end game, which is children, and the crucial importance of children being able to grow up in a home where they're receiving capable parenting. Now, other mechanisms that were, I think, very important in allowing people to develop a sense of collective efficacy, agency, and well-being, and as part of that, a social identity as being a member of PAFRA, it obviously needed to involve some proactive leadership processes that ensured that meetings were run well, there was efficient activity taking place behind the scenes, and UQ took the lead, and me as chair of the establishment of PAFRA was in that role initially, supported by some very capable others who were involved in our centre and postdocs and people like that who were really instrumental in enabling, for example, the development of an environment that was really based around having this shared vision, but having members who were not just lurkers. They just weren't there because they wanted to be part of something and not left out, but were actually putting up their hand to do things. So that the whole idea is that we needed to activate people to contribute, and that the whole idea of the membership was that this would become socially normative. It would be part of the value stance of the organisation, that needed to be based on respectful communication towards each other in a collegial kind of way. This enabled then people to put up their hand and say, look, I'm prepared to work on this, to set up a working party to tackle a particular problem. And examples of these included the NDIS funding for parenting, group parenting programs for parents of children with neurodevelopmental problems, or the Medicare funding rebates that were available for the delivery of evidence-based programs. Now, it's one thing to start off with a hiss and a roar, get lots of energy, lots of commitment, lots of excitement. The challenge is, how do you sustain it? How do you sustain effort over time? And so what we needed to start to think about is what kind of processes would enable engagement to occur that would create an opportunity for contributing people to have access to other valued reinforcers in their academic world and their world of their own priorities. And one of those was to base almost all of the policy advocacy position papers and policy briefs around a scientific peer-reviewed process that would involve the development of papers, scientific papers in the first instance, that individual members could be contributory authors of, named contributory authors of. One of the things that became obvious in the development of these strategies, which I'll illustrate in a moment, is the importance of how this knowledge is communicated, both within the network and much more broadly, and the need to develop a communication strategy that was fit for purpose. We also needed to think about, well, who are the relevant and crucial community and consumer stakeholders that do have a view, an opinion about programs and how research is done and so on. And then we needed opportunities for regular meetings, catching up, and I'll come to that in a moment. This is an example of a paper we published in the Australian-New Zealand Journal of Public Health that was really led by Sophie Havighurst and Karis Cheney, our own Karis Cheney from with LCC affiliation, University of Queensland, who undertook on behalf of PAFRA a very careful analysis of 10 years of government investment in parenting research and found some very interesting things. Over that 10-year period, of the 25,000 grants that were offered across the NHMRC and ARC, less than 0.25% of those grants went into research on parenting interventions, or a total of 62 grants. There were only 2 funded projects relating to the prevention of child maltreatment out of the total spend across both of the major schemes. And you'll see on a kind of a year-to-year basis, considerable variability in the number of projects that are funded, with a few peaks and troughs. But the important thing is that most of the parenting research, or the largest proportion, was focused upon children's physical health rather than mental health or child maltreatment or any other index of children's functioning and well-being. What was also involved is other work that started to articulate and document in the literature why we needed to move away from a highly discrete focus on the bottom quintile of the income distribution and exclusively focused on the most socially disadvantaged families. Those families are extremely important, but parenting concerns and problems as a result of parenting spread across the whole of the socioeconomic spectrum. And it's important that we have a tiered continuum of interventions that are fit for purpose based on level of need. And one of the things that has, I think, not been adequately represented in policy advocacy around families and parenting is the crucial importance of universal and targeted parenting approaches, the blending of the two. So it's not just universal programming. The whole idea is that you have a tiered continuum. And then there's now been starting to be additional work that's done that's linked parenting intervention and their scale up to a variety of the UN Sustainable Development Goals. Now, if you're aware of these Sustainable Development Goals, really it's about creating a new humanity in terms of the way in which we function as humans on this planet. It's partly about sustainable development, but many of the things that you would say, well, we've attained this goal, involve a focus on children. And in focusing on children, we need to focus on parenting, and parenting is not focused on to the degree that it needs to be in these UN statements. So the whole notion of developing a series of policy briefs that would tackle a systemic problem. For example, until recently, it was impossible for psychologists in practice to get Medicare rebates for parenting sessions that involve parent-only sessions. The child actually had to be in the room. Most parenting programs are delivered without the children being in the room for very good reason, because it's often that parents are unable to share what it is that they're actually concerned about when they know their kids are listening. Now, that we took on the Commonwealth relating to that issue, and with advocacy from other groups as well who got behind it, the Medicare item numbers were changed to enable individual sessions to be part of the Medicare system, so that parents could receive an evidence-based parenting program, which was pretty much precluded prior to that. Another example is the work that has been done in relation to the NDIS and the problems that have arisen with these individual packages of care that make it very difficult for parents to access group-based parenting programs that have been demonstrated in the literature to be really effective with parents of children with developmental disabilities, but are really difficult to be able to deliver under the current NDIS arrangements. And then other public policy advocacy work that is continued apart from the research funding and the NDIS has involved a major initiative involving looking at changing the law relating to the use of corporal punishment in Australia, and to need to tackle this both at a Commonwealth and a state-by-state level. But there's a group within PAFRA working with other organisations that are very committed to doing this. In addition to the whole idea of actions taking place through working groups that are led by members of PAFRA who've put up their hand and say, oh, I would like to contribute time and energy to this, we've established a national seminar series that is occurring on a two-monthly basis. The most recent one was just last Thursday, focusing on this whole issue of ending corporal punishment. And a number of other seminars are now being planned on an ongoing basis. And remember, prior to this, and this is one of the good things about the LCC seminar series, because it joins universities together, it joins multiple disciplines to kind of share their knowledge and wisdom and findings. Within PAFRA, we're doing the same kind of thing because for example, our centre, the Parenting Family Support Centre, we've run for 20 years a kind of an every other month seminar program that's largely been confined to our staff and students. And there's no reason why they can't be made much more widely accessible to increase the sharing of knowledge based on this work. Another major project that we made a call on in the first year of PAFRA being established is to establish an international inaugural Congress on evidence-based parenting support. It had never been done before. Because of COVID, it needed to be an online program, and that's how it's going to be in June the 6th to 8th, 2023, being delivered across 4 time zones around the world. But what's been interesting about this process is that we needed to reach out to all the major program developers around the world who had competing programs that often were not in good communication with each other. And the remarkable thing has been is just how many folk have put up their hand and say, this is a really important idea. We need to collectively approach the issue, particularly thinking about low and middle income countries, about what kind of fit for purpose evidence-based parenting services and programs are going to be needed in order to shift the needle at a global level with respect to problems that are a consequence of inadequate parenting or problematic parenting. And this, of course, includes children's mental health, but not only that, it's related to substance abuse, it's related to crime, it's related to how well children do in school, it's related to things like drink driving offences, employability of people. The list is a long one of things that can be influenced by parenting. But in order to bring a global perspective, we needed to establish a number of committees and working groups, which are represented on the right-hand side of this panel, which included the need to build a theory of change to the Congress itself. My theory is that most scientific congresses or professional conferences have little impact on people's subsequent practice or the work that they do. We often preach to the converted. We have confirmatory bias relating to those things that we're already doing, but there's much less action that takes place as a result of knowledge sharing, which could take place if it was designed differently. In the process of creating a Congress that has post-Congress benefit, it was important that PAFRA and the PFSC, my centre, was engaging and collaborating with other groups. Now, one other group that's an important one in the child mental health area is Growing Minds Australia, which has been funded by the NHMRC to establish a new clinical trials network for child and youth mental health. They have similar aspirations in a lot of ways to the Life Course Centre of joining research groups together across nodes, across different priority areas, with much more collaborative engagement in research that involves larger samples, bigger studies with greater capacity for generalising outcomes. And then working with the support of the Academy of Social Sciences, the Parenting Research Centre in Melbourne, ARACI, who've become a supporter, sponsor for the Congress, and of course ongoing support from the Life Course Centre relating to this field of activity. So if you think about an alliance that is creating an event that is seen, when combined with post-Congress action circles, which I'll come to in a moment, has a greater capacity to influence both policy and service delivery and their priorities, which in combination would be hypothesised to increase the benefit to children and families. So the notion of an action circle, which has really been based on the Swedish study action circles that have been around for a long time, and that I heard about through an organisation called From Values to Action.org, which were using action circles of about 5 to 10 people, like-minded folk, coming together to devote as little as 15 minutes a day to come up with, to study a problem and devise a solution. And that action circles were designed to take the learnings from the Congress, which will be, these action circles will be partly formed during the Congress, to translate them into meaningful local, state and national actions in the domain of policymakers, researchers, program developers, and those who are involved in the delivery of clinical or services. And to think about just the crucial importance of actually having a facilitator, having clearly defined goals and outputs that people are working to. Now, this principle has been applied to all the working groups, really, that we've established through PAFRA, who are absolutely kicking goals relating to the things they have set out to do. What we're envisioning in terms of impact is that if this process is effective and we have meaningful engagement of both policymakers and other stakeholders, we should have better informed and more engaged policymakers and researchers who are involved in the development of interventions and strategies to solve problems. And this should, in theory, increase the chances that there's a change in policy priorities to reflect the importance and impact of evidence-based parenting support. It was really disturbing to me to know that we went into a federal election. I didn't hear a single politician from any side of politics talk about parenting support, evidence-based parenting programs. There was a little bit about talking about families and financial support, but a failure to clearly recognise that a change in parenting is a common pathway to produce change in multiple diverse outcomes. At the moment, everything is siloed. It's really hard to identify where the spend is. There's very little accountability. And so when there's no accountability, then the political process doesn't have to respond in the way in which it could and should. So what we need is more dedicated funding for research in key priority areas where parenting is likely to influence the outcomes that we consider to be really important for children and young people that have lifelong implications. And then adequate funding for the implementation and evaluation of these programs once they go to scale. I mean, what often happens is that if you get a grant and it's funding, you'll have money for evaluation that's built into the grant. But if you're getting, subsequent funding from government to implement services, it's a very tiny proportion of the budget, and usually it's inadequate to produce the kind of evaluation that would withstand peer review and that would be publishable. So we're hoping this process will produce a better trained and resource sector. And just remember, this is a sector that is in free fall. There are no ethical standards or principles relating to their training, who is qualified to deliver evidence-based parenting programs. There's a great deal of difficulty in accessing, particularly in pre-service training, high-quality evidence-based training in these programs. Most of the training is done as an in-service-based training, which is fine up to a point. But when you've got people leaving universities who've had no real exposure to evidence-based parenting support, it's much more difficult to turn them around once they've been influenced by service-based priorities that at times can be quite critical of evidence-based programs because of the kind of clientele that they're working with. We would envision another expected outcome to be improved child and youth mental health outcomes and a reduced rate of child maltreatment. The tipping point, exactly what it is in terms of the proportion of the parenting population that needs to participate in an evidence-based program to shift the needle at a population level in child maltreatment, is not really known. It's been achieved with less than 25% of parents participating in a program that was funded by the CDC, a trial of Triple P in South Carolina. For every $1 spent on that prevention intervention, there was about a $9 cost offset by keeping kids out of home placement. So the takeouts for me, after kind of just thinking about where we're up to with this, is that a dedicated and well-supported research alliance or alliances are really valuable tools for producing change, for energizing and mobilizing the field. But we should never think that the work is done because you've happened to do one or two RCTs proving that a program that was developed in the 80s, 90s, 2000s, or just last year is fit for purpose for the current generation of parents, because parenting programs need to continuously evolve to address the contemporary concerns of families, of parents, and of children in this crazy, uncertain world of climate change. Raising kids in a digital world has been a game changer, not just in terms of the issues that parents are dealing with, but how they're preferring to access parenting support. I'd just like to acknowledge the current membership of PAFRA and to just acknowledge the collective efforts of so many people who've got this started, and that we're in the process after a couple of years of getting going where we've got a real momentum that's being created, and this would not have happened without the support of the LCC. So I'd just like to thank you for your attention. If you'd like more information about any of the topics we've talked about today, and particularly this is a call out for members of the LCC, if you would like and are interested in parenting research and would like to become part of PAFRA, you are absolutely welcome. And you can contact pafra.org or contact me personally. And I would be very happy to be an enabler for that to occur. And just ending with, I think, what's an appropriate disclosure statement, because I've been talking a little bit about Triple P, it's just a reminder that this is a program owned by UQ. It's licensed by the university to Triple P International to disseminate the program worldwide. And there are royalties, as there would be, stemming from the dissemination of these programs that are managed by UniQuest and distributed to the Faculty of Health and Behavioural Sciences, School of Psychology, the PFSC, and contributory authors. I'm the founder of the program and I am a lead contributory author. But there's about 13 of us who are involved in this process, and it's an ongoing program that hopefully will never be based on the fact that, I'm coming up to 69 and, at some point I'm going to have to pass over the reins to others to carry this mission forward. But a fundamental commitment to a population-based, evidence-based approach to parenting support, I think, can have a huge impact on the future generation of children and their families.
Thank you so much, Matt. That was very, very interesting work. I'm so glad that you and your team has done such an amazing job to provide one of the most important things to help the children grow, which is like the parenting part. So is there any questions for Matt? You're welcome to talk or like in person or put it in the chat. Kevin? So I guess I'll just jump in for one question while Kevin type. I was wondering, so how do we encourage parents to participate in those parenting programs? And also, I guess the second thing is that coming from different cultural background, there's a lot of ethnic difference in how they treat children. So how do we deal with that kind of ethnic and cultural differences in those
Okay, these are both very important questions. I mean, the first question is, I think we need to normalize and destigmatize it. Basically, to prepare for parenthood is a healthy, normal, desirable thing. Everyone's got something to learn. For some parents participating, it'll be a confirmation that they're on track, they're doing the things that they feel are important in raising their own children, and accessing a parenting program will assist them with that. For those with more serious problems that are influenced by high-quality parenting programs, then it's certainly having appropriate referral mechanisms and pathways for parents to access these programs and services, utilising principles of flexible delivery, so telehealth, in-person delivery, group or individual. There's a lot of ways that people could access it, but often it needs a referral agent who is supportive and encouraging and will facilitate that. With respect to cultural differences, Triple P has been delivered in 22 languages now across 58 countries. There's been a remarkable growth in research in parents who come from diverse cultural backgrounds. And the fundamental principles of positive parenting, a safe, interesting, engaging environment, a positive learning environment, assertive boundaries and limits of kids, reasonable expectations and taking care of yourself seem to resonate with parents everywhere. We've done research in both individualistic and collectivistic cultures that have found very similar outcomes on the fundamental measures of parenting and child outcomes. The parenting journey, even if it's delivered in very diverse contexts, there's much that parents share in common relating to family life. Getting kids to school, getting them fed, dealing with, the day-to-day parenting issues that crop up, bedtime. You can be living in abject poverty, but still need to get your kids to sleep at night. And that there are strategies that are more likely to work and fail.
Thank you so much. So shall we go to Kevin's question first? So Kevin is interested in the structure of the NFP and how that happens.
Well, it was set up as a company limited by guarantee, and then you have to apply with the ACNC for not-for-profit status to enable you to receive funds that would come through donations that are tax deductible. And that's a formal process you have to go through with lawyers and constitutions and boards and so on. It's quite an involved process. We looked at in the early stages, we looked at whether we could get universities to take responsibility for this alliance. And what was clear is that, one, no one had any money to invest in it. And number two, it was seen, you didn't want any single university to be seen as the driver of it. And so there was an advantage in going for a structure outside the university system that was still very much focused on research, but needed to be set up in a different way. And that's what we landed on with advice from ASA. But Kevin, I'd be happy to share in more detail at another time exactly how we did it, and all the traps and hazards and things that make it hard, and how to avoid them.
Yeah, thank you, Matt. Jenny also has a question. Jenny, would you like to just speak?
Yeah, thank you. Look, thanks, Matt. That was interesting as always. I enjoyed, and I've got just a couple of reflections, I suppose, and then a question. But the reflection is, and Hayley's comment in the chat possibly relates to this. But impact takes a very long time. If this work was started back in 1978, it just is I think brings home to us that trying to study and measure impact in the Life Course Centre, we've been going since 2014, but, the impact may come, long after many of us have retired. So that's interesting to sort of think about. It also seems to me that it takes a champion. You bring together an alliance and a group of people, but there's got to be someone that's got the energy and the sustained enthusiasm, in the long term. I guess the other final reflection is that PAFRA sounds a lot like a COE. What you're trying to do with PAFRA is kind of what we're trying to do in the Life Course Centre, bring people together, set up national seminars, have impact, do scientific research. So it's interesting to me how the Life Course Centre might kind of spawn a few of these developments. This could be our legacy around PAFRA and other ideas that people have brought forward. So that's something, you've thought about.
Janine, I couldn't agree with you more, that last thing, that it's sometimes not recognised just how crucial the LCC has been to creating this. And that, this whole notion of working collectively. Just to clarify, PAFRA doesn't actually do research in its own right, funded research. It doesn't compete with its membership, for example, in trying to get grants. It's seen as an enabler to build the capacity, to build our grant competitiveness, if you like, but not to create a situation where we're actually competing directly with the membership who would be applying for government funding, because that to me was the death of it, and it would create conflicts of interest. But
can I just ask?
Yeah.
Sorry, my question really was, and we can talk about this more offline, Matt, and I'd be keen to do that. But my question really was, where is industry and business in all of this? And this is something we struggle with in the centre. So, you're trying to influence government funding. You're trying to you've developed an NGO. Have you thought about, I'm sure you have, going to the big mining companies, the big financial institutions, where's their input and involvement in kind of parenting practices and parenting research? And, that could be the same for any of the things that we're trying to do.
Absolutely.
Where is industry in these equations?
Industry is seen as a key stakeholder. There's already industries involved in the area of parenting research. There are publishers, there are dissemination organisations that are businesses that are needing to function in a manner that enables their sustainment to occur. Otherwise, you go broke giving everything away, and it's a guarantee that you lose control, really, of the whole quality process. So as far as the other foundations and big business is concerned, we're doing an outreach at the moment to them, or a sub-sample of them, who we know are interested in this area of child wellbeing and possible family relating to the Congress. And we're trying to separate what's a Congress-related commitment to more sustained support of an initiative that, remember, no one is paying any fees for, so that there's no institutional membership. It's entirely voluntary, and we've done it basically on the smell of an oily rag, and that which is the Aussie way in a lot of ways, unfortunately. But in some ways, the thought of setting up a COE that would be, something that could happen in the future is a possibility, but the chances of that having been successful, I mean, it's very low success rate with it. And with the LCC occupying that space, we didn't want anything that would compete with the LCC's contribution. And so it seemed better to us to go with an MOU and then this other track that ASA suggested, but it's not out of the question in the future. But to have a philanthropist who's involved in backing this initiative in a serious way, we've also got to be prepared to deal with, and we don't want it attached with strings, where you've got that philanthropist who's really trying to direct and control what it is that the priorities are. We can take that into account, but it shouldn't dictate everything. So we've got to have the right stakeholders. We've got to have the right partnerships. But do you know who didn't have a voice in this area previously? The researchers and program developers. We were on the periphery. You've got lots of other organisations that represent families, that represent, kind of the interests of not-for-profits and community service organisations, even policymakers. But the researchers themselves don't have a voice. Most of the conferences that we go to, I'm interested in CBT. It's mainly an adult-dominated world, and there's very few people in the child and family space. Even in the programs around prevention science, these societies, there is nowhere near the level of engagement of the parenting researchers that are needed to advance the field. And I'm sorry, Janine, I'm too impatient to wait forever. The reason it's taken 40 years is that for the first 20 years, I didn't know what I was doing. And I reckon if I was starting again now, like our students are, there is so much of this you can fast track with just knowing where you're heading. So hopefully the learnings from this are shareable throughout the centre, and anyone who wishes to establish something that wants to make serious change.
Yeah, thank you so much, Matt. I guess that kind of answer Haley's question, which is like, what advice would you give to your younger self about the Triple P, and where are you going to make the real changes?
I would just say treat Triple P simply as an example, and it's a good one. And it's one with a lot of evidence supporting it and so on. But it is just an example of social science innovation being applied to the development of a solution. And that I tell you, one thing that I didn't realise that was so important with this is to have a proper dissemination mechanism established. Because, most grants that develop something don't have a way of getting it out to the field. They don't have a purveyor organisation or dissemination mechanism. So what a lot of people do is that they just put it in Creative Commons. They put it in the public domain with no quality assurance mechanisms there. And it's kind of like they think the problem is solved. No, problem created. Because what you end up having are no quality assurance mechanisms around training, accreditation, delivery, outcome tracking, and so on, which is very, very important.
Yeah, thank you so much, Matt, for this really insightful advice and a very interesting talk. Given the time, we'll have to wrap it up now. So thank the audience of the Life Course Center. So the two coordinators, me and Rennie Lee from UQ, we are welcome anyone to suggest a seminar. Please contact us. A recording of the seminar will be made available in a few weeks, and the details of the next Life Course Center seminar will be available soon. And thank everyone for participating, and have a great day.